Welcome back to our special campaign, Vaccinate India, in partnership with Google. Now, we all take to Google at some time or the other to access the information we need about the pandemic or even about vaccines. We're joined today by an expert doctor to answer some of those questions. Dr. Yusuf Kumble, founder and chairman, Indiana Hospital and Heart Institute, Mangalore, Karnataka, is with us. Thanks so much, Dr. Kumble, for being with us. One of the most important questions, the key question that everyone has asked at some point in time or the other, is, are COVID-19 vaccines safe?
Yeah, definitely it is safe. And for, all vaccine will have some mild side effects, like fever, some body ache, chills and rigor and all. Are we not vaccinating our kids? We are all vaccinating our kids. And like that, this vaccine also will have some minor side effects. But that compared to the benefit, is a huge benefit compared to the minor side effects. So definitely, it has got a huge advantage of this vaccine. And unexpectedly, this COVID vaccine is more effective than what we thought initially.
Right.
That is what as a clinician we see now.
The reason I asked the safety question is because people are apprehensive. One has typically heard that it takes a long period of time to develop a vaccine. These vaccines have been developed in a very short span of time, which is why questions around safety have come up. People are hesitant to use or take the jab of a vaccine that's been developed in such a short span of time. What would you like to tell them?
Yeah, see, because the technology is not completely new. Sometimes we use live attenuated vaccine, sometimes we killed vaccine. This is the new technology, messenger RNA is also used. But it is not like we are talking about 50 years back, the technology was very not well developed. Now we have a modern technology and it's again proved. Initially, we all doctors are in apprehension, it is a short time is come. But however, we are all most of these studies and that in practice also we feel that it is more safer as well as it is more effective also.
Right. So you're saying it's not just safer, but it's also more effective. I want to ask you, Doctor, a lot of questions as people go out to get the vaccine, a lot of questions around what are typically the side effects that one should anticipate after being vaccinated.
One of the side effects is fever, chills, rigor, headache, joint pain, and some muscular pain, as well as some giddiness. Some 1 or 2 days they can have these mild symptoms. And very rarely, what are the major side effects like blood clot in cardiac patients, as well as thrombosis? All these things are maybe 1 in 1 lakh population only that is reported. And that also in venous embolism, venous thromboembolism, as well as arterial thromboembolism. This is negligible. However, if it comes like a headache after 2-3 days after the vaccination, we have to suspect whether any venous thromboembolism might have happened in the brain. And then accordingly, we have to treat. There is a definite treatment also, and it's not mortalities happening in all the cases.
Right. In terms of treating these side effects, are there any preventive medications that can be taken before vaccination? What should one take to treat the side effects after vaccination?
So this you're talking about the minor side effects like fever, myalgia and all. You don't have to take except paracetamol when it comes. There is no prevention. However, those patients who are high risk of thrombosis or venous embolism or arterial thrombosis, these patients are, if they're high risk, they can take oral. Already these people will be taking oral anticoagulation for one or other reasons. That they can continue to take that. Right. And there is no specific preventive only for this purpose, because this is happening 1 in 1 lakh population also. If there is high risk people there's already taking, they have to continue that.
Right. Also, is it true that people who have suffered from COVID-19 and then get vaccinated, there is a higher probability of some kind of side effects in those people?
It's really not true. Actually, those people who are already got infection, and then you vaccinated, and we have not seen any specific side effects for them. For example, in our hospital only, we are a lot of patients who had COVID in the first phase, and now they are all vaccinated. None of them had any side effect. However, there are some people who are getting regular side effect. They are not extra side effect.
Right. All right. Well, those are important clarifications. Thanks so much, Dr. Yusuf Kumble, for sparing your valuable time.
Right. Thank you very much.
Thank you
Yeah.
very much.
Right.